My 7-year-old grandson informed me last night that December is not almost over because it was only the 19th. And I'm like, okay.
They're pretty smart, you know.
Well, he watches that calendar at school pretty closely.
Uh-huh.
Hmm. Senator, Mary, wait for a few more. Well, it's not even 1 o'clock yet. We'll start taking roll.
Good afternoon.
Hey Scott, whenever you're ready, you are live on YouTube.
Okay, thanks, Nicole. That's lucky. Maybe we'll record when we capture this recording. That'll be what my kids who decided not to come home for Christmas will get in their stockings as their present.
I think that's a lovely idea.
One's, of course, on a NATO base in Romania, so it probably isn't fair to penalize him, but the other one.
Mm. That one might get a little slack.
Claudio, good to see you. There's Sheriff Easter. 2, 3, 4, 5, 6. We'll see if we get one more panel member, and then we'll have enough of a quorum to at least act on the minutes. Give it another minute. Maybe we'll start and come back to approval of the minutes if we get one more panel member. I think that would get us our quorum, but to respect your time today, we'll call the meeting to order. Scott Bruner with KDADS. Thanks for joining today. Thanks for being flexible to do a virtual meeting as well. It's made it a little easier for everybody to get together. We've got a few mostly updates to provide today, so we can, I think, move through it fairly quickly. We'll come back to approval of the minutes, but those I attached them to the meeting appointment yesterday, I think, yesterday morning. But so if you had a chance to look at those, maybe without the quorum, we'll go on to the third item, general contractor award. It's kind of our big news for the week. So Tanya, would you like to give us an update on the general contractor?
I will do that. Good afternoon, panel. Tanya Cole, Assistant County Manager. So I have what I believe is great news for the panel to hear. This week, the Board of County Commissioners awarded the general contract award for the mental health hospital to Key Construction. And before I get into that, let me just recap on this. So the RFB went out. It was published on October 11th of this year, and the bids were due on November 26th. And there were 7 addenda that went out for the RFB. And we received 2 bids back, J.E. Dunn Construction and Key Construction. And we awarded to the low bid Key Construction. And so I included, and I think Scott sent it out, the bid board minutes for the award. And so I thought it would be important for you all to see that if you had an opportunity to see that.
I'm going to try to share it, Tanya, just so it's on the screen too. Is that okay?
Yeah.
Let me see if I can do that.
Okay, that'd be great.
Okay.
Okay, so as Scott's sharing that, I just want to go over so you can see and understand. Volume 1 and Volume 2, that is the base bid. That's just basically the construction of the entire building. The alternate one, Volume 3, what that is basically all your medical equipment and your furniture, fixtures, and equipment. And so that brings, and then let me back up there, then the fixed jointly managed contingency. So all of our projects have a contingency, but ARPA requires that you identify that you're very transparent in what your contingency is. And so that's $5 million in our project. So total award for this project is the $86.9 million for Key Construction. And so again, two bids there, and we awarded the low bid to Key Construction. If you want to scroll down, Scott, on that. So what I provided in the backup material is I just wanted everyone to understand that there were qualifications that were required in this award. And I'll just go through it. I know we've got a lot, but I'll just go through it real quick. There was some qualifications regarding the experience of the firm. That was number 1. And there had to be experience of the firm officers. They had to have, adequate financial resources. They had to have work in hand capacity, adequate organization to complete the scope of work, acceptable past performance, and then documentation, if requested, that they have a commitment to fair inclusion of small businesses, minority businesses, and women-owned businesses. And I will tell you that we did our due diligence on this as far as going through the qualifications and talking to their references. We did have an evaluation team that included Sedgwick County purchasing representative, the director of facilities, myself, KDADS included, Scott Bruner, Arena, and John Golighty, who I believe is their director of facilities. And then, of course, our design group, and recommended Key Construction for award. One of the questions that was asked was if we had any concern that we only had 2 bids. My answer to that was no. I feel very confident with awarding to Key Construction. I will just explain that we were expecting more bids, and so we reached out to one of the prospective bidders, and they did explain that they did decide at the very last minute, prior to turning in their award, that they did decide to pull out, and that was because they had submitted for another bid prior to that, and so there was just a concern on their workforce. But I do feel confident in our review of as we were going through this with Key Construction, and I certainly want to ask Scott and Irina if they want to add to that. But that's where we're at, and I think it's very good news, I think, at this point. The other thing I might just mention is in our contract, the substantial completion is when we would turn over the building to KDADS. The substantial completion date for this mental health hospital is October 31 of 2026, and then final completion would be 11/30 of 2026. And they have agreed to that. So I'll just add, if Scott or Irina, if you want to add anything to that, if I missed something.
I was going to have you mention the period of performance as well, which you just did. And let's scroll back up, because in terms of who the project was sent to 155 different vendors, people who had registered for the pre-bid. I think a lot of folks from the state list as well of potential construction vendors that the state's used on projects, and as well as the county. So it was pretty widely distributed. And I think from the participation you had at the pre-bid conference and things, there were lots of people looking at this offer, and then just getting two proposals was again probably a little surprising, but we do feel like we gave it a good shot to get as many potential bids as possible. Irene, anything you want to add before I open it up for questions?
Good afternoon. No, I think both of you covered everything, and just want to say that we're looking forward to breaking grounds and starting on construction, but definitely feel confident that it's going to be a good experience.
Are there any questions from any other panel members about the bid process or the contract award?
Yeah, Scott, the only question I have is this for a 50-bed or 100-bed facility?
104. This is for the full design.
Full 104. Okay, thank you.
Good question. Any other questions about the contract award?
Thank you.
So the commission took this up on Wednesday and approved you to go forward, and you're finalizing the contract language today, you expect, or soon?
Yes, I assume that question is for me, Scott. Is that correct?
Yeah, I'm sorry, it was Tammy.
Yes.
Thanks.
We are just finalizing the contract, and it's hopeful that we will get all of that signed today.
Okay. Any other questions about the contract process? Okay, we still haven't gained a seventh member to vote on the minutes, so we'll just keep proceeding through the agenda. We wanted to give you some project updates, and Irina was going to go first as from her role as superintendent. I can try to share your document too, Irina, if that's okay.
Yep, that would be wonderful. Thank you.
Here. 3.
Just
Okay.
go ahead and get
Yep,
started then.
Yeah.
Earlier today, I shared the document with the panel, and hopefully it's going to be easier to read. Item number 1, there was a request to share the membership of the steering committee that is advising and making recommendations on key organizational questions going forward. And we have a team of KDADs, Leonard State Hospital and also Otomi State Hospital, consisting of both administrative and clinical leadership. I'm not going to go through every name, but you have it available in the handouts, and they can become part of the minutes as well. And the next point as we move forward, we did talk about the fact that we were working on collecting some additional data, especially since we confirmed that we are now looking at the 104 beds versus 52. I do want to share that the data that we have been able to collect for the last couple of years reflects that our the number of beds is going to serve the population that we need to serve. So this data represents admissions for the fiscal year 2023 and 2024 from the counties that this hospital is going to serve. I don't know if you can, if it's large enough for you to see, but just to summarize, from Sedgwick, Butler, Coley, Sumner, Harvey counties, there were a total of 416 admissions in fiscal year 2023 and 432 in fiscal year 2024. Majority of the admissions definitely were from the Sedgwick County, and about 70% of them went to OSH. I also want to point of the ones that went to state hospital. I also would like to point out that the state institutional alternative program, the program that was launched in 2021 to help serve patients that would otherwise go to the state hospitals, served 291 and 258 adults from these counties respectively. So really the state institutional alternative program has served a large number of the patients from the counties. Of those patients, Via Christi SIA that we partner with served 151 and 152 patients. So we wanted to share this data to explain that in our projected bed utilization, we are projecting the most likely scenario that this hospital will take at least 50% of the patients that Via Christi SIA is currently serving, and hopefully that will reduce the wait times for Sedgwick County considerably. If you look at the pie charts, it shows that the blue shows the short-term patient admissions, and the orange demonstrates the longer-term admissions. When we talk about the short-term, we look at the 12 to 15 days of stay, and the long-term are patients that have an average length of stay of 127 days, but really looking at those that exceed the 15 days length of stay. So definitely, while the majority of admissions are short-term, it is important to note that the longer-term patients or the long-term patients really, the length of the stay will impact the number of beds that are being used for at the hospital. Scott, if you could move it further down. So we also looked at the number of duly admitted patients or duly committed patients, those patients that have both the criminal and the civil commitment. So a lot of those patients, or really the patients, come as a transition from the and they will come as a transition from the 52 beds that will be serving the forensic population. So once the patient undergoes evaluation and it is determined that restoration services are needed, and if they have the civil commitment at the same time, that's the patients that we're talking about. The numbers are not very high, and they're in the single digits. However, these are really the patients that sometimes take multiple years before they can be discharged, or in really many instances, these are the patients that cannot be discharged for very, very many years. So if you look at these numbers, the table on the right or the box on the right shows that currently the patients from these 5 counties with stay that is over 155 days, where we currently have 23 patients. However, of those patients, most of them are over 1, 2, or 3 years. So really, that's almost a permanent time that these patients would take the beds, and we wouldn't see a lot of the rotation in those beds. You could scroll down, Scott. So based on
But before
Go
you
ahead.
move to the next part, just to make sure that the panel is a little bit of context for the panel. So one of the questions we've been working on is, we know we have the split of beds between forensic beds for criminal defendants and civil commitment beds that are, acute mental illness, and we've talked about how that works at Larned and Osawatomie as well. What we've been trying to figure out is, given the catchment area that we've identified, do we have the right size of a facility in Sedgwick County to serve the potential population from that area? And generally the answer is yes, but one other specific question is, if we have patients or defendants who are not competent to stand trial but can't be released, and they have to be detained, what happens under law now is, if you're not restorable to competency, then your case moves from being a criminal case to a civil commitment case, and we keep trying to treat you. And right now, the way we do that is move people from the secure program to psychiatric services. So, but because their length of stay is so long, we were worried about how many beds we'd have to reserve for that purpose and how the programming might need to be different. And so we just wanted to get a sense of where does this facility fit in our system of being able to serve patients that have those longer term needs. And anyway, so that's a little bit of the context. We don't want to have you all are aware of the design. It's pretty compact. We don't have a big campus. We don't have some of the vocational programming, may not have some of the vocational programming that the other campuses have. So just trying to figure out the right purpose. This is one of those programming versus facility questions we're trying to resolve. So we have a recommendation, and that's what Irina is going to go into, but I did want to set a little more context. Senator Reddy, before we move on, you've got your hand up.
Thank you, Scott. I appreciate the information. So 2 questions. When we talk about the dual commitment admissions, are we just talking about the counties represented here between Butler, Cowley, Sedgwick, Sumner, and Harvey, or are we talking about the state of Kansas? My second question is, if we are just talking about these counties, where do those other patients go? Where do those other dual commitment admissions patients go?
Irina,
Very
go ahead.
Okay, thank you. Yeah, thank you for the question. Very good question. So all this data that is presented only looks at these 5 counties that this hospital will be serving. And currently, really all the patients from all the state counties are being served at Osawatomie and Leonard. Obviously, Sedgwick County is served at Osawatomie, and so the largest number of patients that are duly committed and longer term from Sedgwick County are being served at Osawatomie currently, and that's where the number of the 23 long-term patients that are currently being served also comes from. I do want to know, though, of the 23 patients, not all the patients are dual commitment, but some of them only are civilly committed. So, but still long-term stay. Very good question. So again,
Senator
we're
Reddy,
looking.
then it falls under the catchment areas. So we go back to it depends a little bit on where they were coming from in terms of the original court order or criminal case, but it follows the existing catchment area lines.
Okay, so this will alleviate some of the beds in Larned and Osawatomie then? A little bit, but maybe not a whole lot for those.
More Osawatomie than Larned, but yes.
Okay, all right, thank you.
So actually, based on the numbers, upward 20 to 22% of admissions in Osawatomie were from Sedgwick County. So really that is going to help with the number of beds available. I do want to mention that the current patients that are being served at Osh and Leonard, the longer term, I don't know that we have I don't know that they will move anywhere, so those longer term patients will remain at those hospitals, but going forward, we will have additional beds for the patients. We also understand that in bringing this hospital on board with 52 beds that are dedicated to forensic patients and evaluation and restoration services, really that is going to increase the number of patients that will be in need of a longer term service as they move through the program as well. So in looking at the most likely scenario of bed utilization and projected use of beds, we predict that about that we're looking at what we call the acute side of the hospital, right? The 52 beds will be used for forensic definitely, but then the other 52, we project that shorter term stay patients will on average occupy 13 beds, longer term patients with an average length of stay of 127 days will take about 13 beds, and then those with over 155 days will take about 23 beds eventually. Obviously, that's a projection. I think that we should expect to see those numbers in about a couple of years from opening, and obviously the first year or two will be different as we look at the admissions with more patients that are shorter term being served. And then eventually, as we get longer term patients, they would take more beds. Any questions or comments about?
So bottom line is we think with the 52 beds on the acute side is about right. We think we've got the right catchment area identified in terms of the patient flow. Again, we think there's a good rationale to have a treatment model that'll support both acute stabilization and some longer term treatment. That was one question that we were working on internally of maybe it makes sense if you've got a longer term patient, we get them to Osawatomie or Larned where they've got programming that fits that longer stay. Where we are right now is that probably isn't, we don't need to think about that as much as kind of building out the programming inside the walls in Sedgwick County. But we feel like the size is right. We were maybe 80% confident going to 104. Now this helps us and looking at the data over a couple of years, it helps us have more confidence that we're at the right size.
Thank you, Scott.
Yep. Any other questions about admissions or the patient mix? Okay, we're gonna keep going.
I guess one more thing that I wanted to mention in addition to what we have just discussed is that this data really looks at the patients that are primarily involuntarily admitted to the hospital, because most of the time right now, both Leonard and Osawatomie and really majority of the SAAs serve involuntarily committed patients. But that being said, if initially the beds that we project will be used by the longer term patients are not used from the very beginning, there definitely will be a need for patients that are not, they're referred to state hospital, but are not necessarily involuntarily committed as well. So really, one of the reasons why we looked at the data is also to help us inform our next steps and decisions on licensure and certification. And I wanted to provide a little bit of a background of what we are looking at and some of the decisions that we have made. So the hospital will be licensed as one facility with 104 beds that is going to be the licenses issued by KDH&E, and that's a license that's similar to Osawatomie and or the same as Osawatomie and Leonard, and that's licensure for medical care facility license and special hospital, a psychiatric hospital. So that's a license for 104 beds. Then as we go further, 52 beds that are forensic cannot be certified or accredited because they would not meet some of the requirements for the certification or Joint Commission accreditation. So we're looking at 52 beds that are more acute, or what we call the short-term and the longer-term beds, to be accredited as a distinct part by Joint Commission as a psychiatric hospital. Really, what that means is once the hospital is accredited by the Joint Commission, there is a notion of deemed status, and that means that the hospital meets all the requirements for the certification by the Center of Medicare and Medicaid. So if we are Joint Commission certified, and we meet all the hospital standards in addition to two special psych hospital standards, then the hospital would have both accreditation by the Joint Commission and certification by CMS. Now, because part of the forensic part cannot be certified or accredited, the plan is to have it the plan is to have the 52 acute beds certified and accredited as a distinct part. And what it means in turn is that there are certain requirements that we need to meet in terms of showing that we are certifying the distinct part. The main considerations that we need to look at is the physical environment separation. We have built it into our design of the hospital with physical environment separation of the two units on the forensic and 2 units on the acute side, and really all the admissions to different units. The next thing is ensuring that in addition to the physical space, all the operational workflows are also designed in a way where the patients never from one part of the hospital never really interfere or meet even the other part of the hospital. And then the third piece is really ensuring that there is a separate medical and professional staff, including doctors, therapists, and nurses. And that really means in turn that we would have to have doubling of positions for some of the areas. For instance, we cannot share the same head of the medical staff or chief medical officer. We have to have separate therapists and nursing staff that are dedicated to these two parts of the hospital. So while we're looking at being certified and accredited, that also means that we have some positions that are going to be duplicated and would otherwise just be one role. But that's a requirement that we have to meet. However, the operational support services can be shared. So some of the services like food service, laundry, facility services, all of those services can be shared and will be shared. And the relationship between the two parts of the hospital will be documented through memorandums of understanding, and with really all the services also meeting the Joint Commission and CMS requirements. And Claudio, you have a question?
Yeah, Irina, I was just wondering, does that preclude talent share between like Via Christi and that distinct park unit? Or, in case there's like, we both have PRNs or things like that,
Yep.
is that allowable?
No, it doesn't. So really what it means is, for instance, if we, it doesn't stop us from potentially using the same staff, but they cannot be scheduled to work the same shift, the same day on different hospitals. So literally what that means is if we had doctor who wanted to work both at Via Christi and the new hospital, we would have to treat it the same way if they wanted to work at the acute side of the hospital and the forensic part of the hospital. And in turn, that means, for instance, that if we have a physician that works both parts of the hospital, they have to be credentialed twice, and everything, all the records, training, everything has to be separated as if those were completely two different entities. Hope that makes sense.
Monica, your hand's up. No, it's not.
Sorry, I didn't mean to do that.
That's okay. You may have just been asking to stop, because we've been through around a couple of times. So you're getting the distilled version of it.
I am just really pleased that we have Irina to do this job. My goodness,
Me
talk
too.
about important
too.
details.
Thank you.
Me too. We're raising it or wanting you all to be aware, because the staffing plan is driven by this decision. So, and I think Irina made that point very well, that you'll see some when we build out the staffing plan and share that with you after the first of the year. You'll see some places where there's duplication, and that's intentional because we have to. Places where it's not duplicated is also intentional because we don't have to. And I think we're again getting more confident in where that split is, and what that means for our overall number, which is, it comes down to a budget question at the end of the day.
And I just wanted to provide a couple more updates. I'm very happy to share that we will have our first, or I guess second after myself, employee starting January 6th. And we have hired Director of Facility Services who will join us right on time to help with oversight of construction process as well. I think that's all the updates that I have. Thank you.
Any other questions for Irina? Sender, ready.
Yeah, not necessarily for Irina, but I think for you, more importantly. So some of these measures require, I think, at least some more funding, or funding that's already there. And as legislators are looking at the budget, and then the governor is going to be looking at the budget, are any of these fiscal items going to be in jeopardy? And if so, how do we make sure that they are intact? Because that's what we're counting on to make sure this is a successful project.
That's a really good question. So we don't have to prepare a full operational budget for this building really this year, and so it's not going to be included in the budget deliberations that'll start in January. But we've got a pretty good plan for the next fiscal year in time for the next budget submission. That would be the full implementation budget, which is about half a year of salaries for a larger group than just Irina and the facilities director, kind of the key leadership group, to get us to the opening, or to the transition date in October or November. Once we have the building, then we can really ramp up the hiring of the nursing staff, clinical staff, the facilities folks. It doesn't make a lot of sense to hire them much in advance of having a building. So that'll be more in the next budget cycle. I think in the projections that we've done so far, we've got a standing appropriation of $15 million for construction and operations. We don't need it for construction. That'll go towards operations. Best guess today and what we've projected so far, that was $15 million for 50 beds. So now we're twice as big. So I assume we're going to need some additional money, maybe 10 million on top of that to really fund the full operational budget for a year, given the scale. But that'll be more of a decision next year. I hope we have that laid out as we go through this budget cycle, just so everybody can be aware of what we're going to be asking for. But the ask is not as much as it's not this year, but it will be next year. The other good part is, given what we've been appropriated so far, and if we can keep the construction at the cost that we've got, we're going to have a good, almost that full fiscal year 2026 appropriation or 2027 appropriation available for operations. So I think we're going to coast into a good spot when we have to operate. We are still going to have a budget request, but it'll be in the next budget cycle.
Okay, sounds good. Thank you.
And the other thing we don't know, just a full picture. So if we get part of the building certified, we can bill Medicaid for some of those services, but like we do at the other hospitals, and that'll offset the operations a bit as well. So again, this decision has implications both for how we build, but it's also so we can bill Medicaid and get some other federal share for some parts of it.
Right. Now, I think that's extremely important for how the healthcare, insurance, and all of those play a factor. But this is such a bipartisan issue, mental health, I mean, and the challenges and the workforce needs. I think it will always have support, but I think the legislators always have to constantly be educated or given a lot of information so they're not blindsided by the needs and the operational costs. But I think we are headed in the right direction, and I do see a commitment, and I hope that stays as a true commitment, because it's probably going to get more expensive as we move forward, but it's very much a need. So,
other questions? Okay, I had one update that I wanted to provide for legislative updates for the session in January. So the primary legislative initiative we've got for the 2025 session is creating this hospital in statute, so we can have our own state agency number, authorize it as a location and as a state hospital under the auspices of KDADS. Part of that would also identify the catchment area. So we've talked about, stop sharing here a little bit. So we've talked about that would be starting with Sedgwick, Butler, Cowley, Sumner, and Harvey counties as the proposed catchment area when we open. And then if we're going to create the agency, we have to give it a name. So we've got approval from the governor's office to do all of those things, to put that into a legislative request to start this session. So not everybody asks, but I usually mention anyway, if it wouldn't pass this year, it wouldn't be the end of the world. It'd be nice if we could get it done this year. If we don't, then we definitely would have to do it next year, just so we can have the accounting structure in the right place. But again, I think, and I don't want to jinx it, but I think Senator Reddy's point's a good one. I mean, there's good support. We got great support from the county and the delegation and others to do this project. This is really just kind of the administrative part of creating a new agency. So hopefully it won't be overly controversial, but it'll be a bill, and it'll require people to vote on it, and it may be one of those things that gets thrown into a package at the end of the session. We'll see and keep you informed. But that's our primary objective. So that ties to the next item as well, of what the possible name of the building will be. So what I've got is approval to go ahead and create an agency in statute, create this as the catchment area, authorize it under the KDAD statute. The name that the governor's office has, for discussion purposes, has signed off on is the South Central Regional Mental Health Hospital. Naming is an interesting process. There's lots of things, lots of thoughts about it. We've kicked around lots of different names. There are some things that we've ruled out as an agency and as a staff, and I think that we've talked about as a panel. We don't really want Wichita included or not included. We don't want Wichita in the name. We think that's confusing. Sedgwick County, we've talked about. There's a regional focus to our work over the last year. It's certainly dedicated. This is a hospital dedicated to South Central Kansas and a number of other counties. So we don't really want to use the word Sedgwick. So now we have this kind of regional name of South Central. We like the idea of identifying the region, and we don't want to use psychiatric. We want to use mental health instead of that. And I'm the one who insists on having the word hospital in the title. So you cobble all those things together, and you end up with South Central Regional Mental Health Hospital. We're going to put it in a bill that way. People will want to debate it and see if there are other ideas. I did want to pause just a minute and see if the panel had other thoughts about naming or suggestions or caveats along the way, given that as being one of the options. Any thoughts? So sorry, I didn't really make that much of a question. That was my report. We're going to write a bill, and then the next item is about ideas about naming that that we haven't already talked about. Got one resounding vote yes from Claudio, so that's helpful. Well, if you have other thoughts, yeah, I'm sorry. Go ahead.
No, I was just going to say, I'll just agree with the points you made where I think regional and South Central I mean, those are all things that are important to the naming process for clarity and for understanding about what it is. So I think it's a good, solid way to go.
Thanks, Mary.
God, I would agree with Mary's statements and on that as well. So
thanks, Sharon. Well, if you have other thoughts or other ideas, certainly send them our way. We'll incorporate that. I don't know, that's the least controversial. Well, the controversial part is we don't have a good acronym from that. So we're really working on some shortened name, which is it's been a creative process to get to this point. Trying to come up with something that uses those letters is going to tax all of our creativity, but we'll keep working on that as well. The next to last item that we wanted to raise with our friends from Greenbush. So I think we've done a pretty good job of updating the public and citizens of Sedgwick County and our neighbors around the site as we kind of reach the kind of critical milestones in the project. Awarding the construction contract is one. We've got the finalized design and renderings that I guess we've shown some of those in the event that we had in the fall, but we were thinking about going into 2025 and what other public updates we ought to do or should think about doing. We've discussed internally with the staff, I guess within KDADS and Greenbush that work with us, of maybe doing something in January that would be another opportunity to talk about the construction contracts award. Maybe we have a firmer deadline or timeline of when we're going to break ground, the completion dates, kind of milestones of the project. January and February feel about the same in terms of start, so we could do something kind of in between those 2 months. The other kind of public part that we'd want to talk about as we get our staffing plan figured out, and we can say in the next 18 months we're going to be looking to hire some number of psychiatrists, of nurses, of technicians. Maybe we can put a little more specificity around the numbers of hiring, and then maybe there's also some effort to talk about with the Behavioral Health Center of Excellence and some of the workforce initiatives that they're rolling out, kind of doing a joint public town hall kind of event. So we're just looking for feedback from the panel on timing of a town hall, either an event or something virtual, and then some ideas about what we'd want to talk about or content. Claudio's hands up.
Yeah, so Scott, I was just gonna say, there been any discussion on my sort of a media plan to augment the, the uh, town halls, if you will, with the community? I think telling the story along the way is an important thing, and you'll catch a lot more people that way. The media will definitely pick this up.
It's a good idea. If we had a groundbreaking, the other kind of event we know is going to happen is some kind of a groundbreaking, and we're not quite sure where to place that until we get Key on board and figure out what, the weather's a variable too. So, but that's a good idea. We were thinking of either a town hall or some kind of a virtual town hall before we break ground, and then the groundbreaking would be kind of the big public event well, not public it'll be, but big event more in the spring. But we'll add a media plan to our list of things that we need to work on as well. Other thoughts about timing or content? No, Claudia, you had mentioned it one other time about maybe doing some kind of a specific outreach to medical societies, the local psychiatrists, more provider focused. We agree that's a good idea. We can kind of fit that in as well. Now, it was part of a panel for the Sedgwick County Medical Society at Via Christi, and an event like that would be a good time to talk about where we are and what the project looks like. So something along those lines as well. Any other thoughts about Monica or Ryan, Greenbush folks that we talked about for timing or content? Okay, well, we'll keep you posted. I think we'll do something again with the legislative session starting. Just a lot of moving parts, but we know we need to do something. So that probably the intent is important as well. Let's see. Oh, one last item before maybe we adjourn or see if there's a kind of open up for discussion. So by the executive order, our charge runs out in March. So I'm planning for us to meet in January, February, and then in March. One of the topics that came from the sub-panel work and our recommendations was an update about children's services from KDADS, just to highlight those things. And I'm working with the behavioral health team to put something like that together. I don't know that we'll be ready to do that in January, but that might be a part of our February meeting. Again, we'll want to talk about the staffing plan, make sure you're all aware of that as best we can figure it out before March when our charge expires. And then the third item that I've got is the Behavioral Health Center of Excellence. They've made some progress on their initiatives over the last 4 or 5 months. And so I do want them to provide an update of kind of the staffing workforce initiatives that they've got working. But are there other agenda items or topics for the panel that you'd like to hear about over the next couple of months before we close out our work? Well, maybe I'll leave that there with you all to think about as you kind of look at the end of the year and where we're going this year. And if you have an idea, have some thoughts about items we want to talk about. We do have some other kind of law enforcement interactions. I don't know that feels like much of a presentation because we can work with the sheriff and DA Bennett on some of the ideas that we've got, and it's a little more operational anyway. So, but anyway, if you have ideas of things for the agendas in January, February, and March, that would be great to know so we can meet all of your needs. Any other last comments or thoughts before we adjourn for the day or the year? Senator.
Yes, thanks, Scott. I was wondering, about the appointments to this committee. Was this if you needed a sitting senator, or as if it's at the pleasure of the governor? If you can find out, that would be helpful.
I will check for sure. That's on my list to do before the end of the year as well, just to make sure. But my understanding was that your appointment is for you. It's not position based.
Okay.
And the same would be true for you, Commissioner Lopez, as well. You have an appointment yourself, not for the county commission.
Okay, great. Thank you.
Any other items for today? I don't see any. It's been a really busy couple of months, maybe 4 weeks, for the Sedgwick County team to get this the RFP for the construction contract put together and out. The Pulse folks aren't on today, but they did a tremendous amount of work to get those documents ready for contractors to look at. So thanks to both the county and Pulse for all their work. I think we've got a really good vendor, excited about the general contractor coming on board. Maybe we have them come in January too, and they can talk a little bit about what they're looking forward to or not. Well, I mean, whatever, provide an update from their point of view as the general contractor. But big milestone. So really excited about the progress and where we are going into the end of the year. There isn't any. So thanks you all for your participation over the last year. We've got a few more months to meet, but it's been really valuable to us to have these opportunities to provide updates and keep you all informed. So I wish you all the very best for the holiday season and end of the year. And if we don't talk before, we'll see you in 2025.